I would like to welcome you to St. Joseph Hospital North Total Shoulder Replacement Program. We are pleased you have chosen our facility for your total shoulder replacement surgery. Our goal is to return you to the best of health as soon as possible. There's a lot to think about before surgery. Today, we are going to provide you with information to help you become more familiar with the process involved with your surgery, hospitalization, and recovery. We hope this will answer your questions and reassure you about your total joint surgery. Learning as much as possible will help you play a more active role in your recovery. Welcome to St. Joseph North. All of our total shoulder patients will be cared for by our specialized orthopedic care team before and after surgery. Here at St. Joseph North, we follow a clinical pathway of excellence. We utilize cutting-edge technology and techniques, which allow the majority of our patients to leave the hospital the day of surgery or day after surgery. Pain management techniques include your multimodal approach, helps decrease narcotic consumptions. We also strive for top decile patient satisfaction scores throughout our facilities to ensure you have a positive experience while here for your surgery.
St. Joseph Hospital North is promoting a healthy lifestyle. There are no smoke areas in our facility. If you smoke, you might want to consider stopping prior to your surgery. If you feel you will need a nicotine patch for your stay, please notify your surgeon.
Preparing for your surgery preoperatively is an important aspect to your overall care and recovery after total joint replacement. No surgical procedure can take place without us first taking a good look at your overall health. You will have an appointment with your primary care physician prior to surgery and will need to be medically cleared to undergo this procedure. Some patients will be required to see a specialist in addition to your primary care, such as cardiologist or pulmonologist. In order for your surgeon to do his job to the best of his ability, your surgeon needs to know about your medical history. Your surgeon or primary care physician will perform a pre-op physical to ensure that you are healthy enough to undergo total shoulder replacement surgery. If you have any cardiac history, they will also have you follow up with your cardiologist to get cardiac clearance before surgery. Prior to your surgery, you will have an appointment with pre-op emissions testing. The pre-op emissions testing department will call you to schedule this appointment. They will be going over medication, advanced directives, preoperative instructions, and additional necessary testing. They will ask you for a thorough list of your medications, including prescribed medications, over-the-counter medications, and supplements. Based on anesthesia guidelines, there may be medications that must be stopped in order to have a safe and successful joint replacement. During this appointment, a pre-op emissions testing nurse will instruct you to stop taking certain vitamins or medication 2 weeks prior to your surgery. You cannot take ibuprofen, Aleve, Advil, or Motrin 7 days prior to surgery. Tylenol is fine to take up until the day of surgery. If you take a prescribed blood thinner such as Coumadin, Pradaxa, Plavix, Eliquis, or Xarelto, you will receive special instructions on when that needs to be stopped. During your pre-admissions testing appointment, you will have your MRSA-MISA nasal swabs completed. If positive, a nurse will contact you for treatment to help prevent infection after surgery. Additionally, you will be provided with a soap called chlorhexidine cleanse at your appointment. PAT nurse will give instructions on how to use the soap prior to surgery. The day of surgery, you will wash with only soap and water. Do not apply any lotions, creams, deodorant, or makeup the day of surgery. Finally, any additional blood work or EKG not yet completed can be obtained. Keep in mind your surgeon should be notified of any changes to your medical condition or medications prior to your surgery. Insurance coverage, healthcare benefits are constantly changing. It is important for you to understand your benefits before undergoing surgery. Call your insurance provider to find out exactly what your plan does and does not cover. You may be prescribed a blood thinner after surgery. The copays on these medications can be costly. You may want to call your prescription insurance to find out what your copay will be on these medications. The four most common medications prescribed are Lovenox, Xarelto, Eliquis, and aspirin. If you are prescribed aspirin as your blood thinner, that is not a costly medication. How they determine which blood thinner you will be placed on is based on your surgeon's preference and your medical history. Scheduling office phone calls. You will receive a phone call from your scheduling office the day before surgery. They will call anytime between 2 p.m. and 7 p.m. to tell you what time to report to the hospital on the day of surgery. They will also instruct you to have nothing to eat or drink after midnight. If you are told to take medications the day of surgery, take with just a small sip of water. If you are not home, they will leave a message on your voicemail. If you are a Monday surgery, you will receive a phone call on Friday afternoon. Physical condition changes. Report any changes in your physical condition to your physician. A number of problems may require postponement of your surgery. These include a sore throat, a cold, fever, dental problems, difficulty urinating, and skin conditions such as rashes or abrasions. If you have any questions about whether you are healthy enough to undergo surgery, please ask a member of your healthcare team. Healthcare directives. A healthcare directive, also known as a living will, gives a person of your choice the power to act on your behalf during medical emergency you may suffer. This document is used to ensure that your wishes are followed even if you are no longer able to communicate them yourself. If you already have a living will completed, please bring a copy to the hospital so it can be a part of your medical records. If you would like to have one filled out before surgery, you can find the form on page 19 in your booklet. BayCare and St. Joseph Hospital North. Priority is the health and wellness of our communities, keeping patients, team members, and physicians safe. There have been enhanced safety and cleaning measures to ensure a safe environment while in the hospital. For additional information regarding visitation hours, please contact the hospital directly for the most up-to-date information. As you prepare for your surgery, we would like you to prepare your home. Your Total Shoulder Education book has a checklist of ideas to prepare your home for return after surgery. For example, we would like for you to remove tripping hazards like throw rugs, loose cords, any clutter before surgery. It may also be helpful to move frequently used items to waist level. You can look through the checklist for other suggestions. Meal preparation can be beneficial as you are recovering. You may not be able to get up and cook a full meal. Your book also provides guidance on what to bring to the hospital. Bringing a few items from home may make your hospital stay more comfortable. The hospital does provide you with toiletries such as toothbrush, toothpaste, lotion, etc., but people prefer to bring these items from home. You will be provided with a hospital gown to wear during your hospital stay, but some people prefer to wear their own clothing. If you would like to bring clothing from home, make sure you bring clothing that is loose-fitting and comfortable. Loose and comfortable oversized t-shirts or button-down short-sleeve shirts with larger buttons are preferred and will be easiest for you to use after your shoulder replacement surgery. The hospital does have free Wi-Fi available, so if you would like to bring electronic devices such as laptops, iPads, tablets, you may. It is important to bring your own dentures, hearing aids, or CPAP machine if used at home. I am going to talk with you a little bit later about the potential use of on-campus pharmacy we have available for you. If you are interested in using this pharmacy, you will want to bring in a credit card, debit card, cash, so you have a form of payment for your copay. Please do not bring any medications from home during your hospital stay. The nurse will be providing you with medications from our inpatient pharmacy. The hospital is not responsible for any lost or stolen items. Please leave all jewelry and valuables at home. As mentioned on the previous slide, preventing falls is a crucial part of our safety after surgery. This list describes some of the easy ways you can try and prevent falls at home by preparing prior to coming in for your surgery.
As mentioned on the previous slide, preventing falls is a crucial part of your safety after surgery. This list describes some of the easy ways you can try and prevent falls at home by preparing prior to coming in for your surgery.
Keeping you safe is our top priority. We will regularly ask you to identify yourself by stating your name and date of birth and comparing it to your identification armband. The barcode will be scanned on your armband for medications and procedures. This ensures we provide the right treatment, test, and medications during your hospital stay with us. One of our goals is to prevent the spread of infection to our patients. Your healthcare team will wash with soap and water or use alcohol gel before and after each patient encounter. If you have concerns that your healthcare provider has not washed his or her hands, please speak up and ask them. Your surgeon may also order IV antibiotics before surgery and following your surgery to help prevent surgical site infections. Additionally, any visitor should also wash his or her hands upon entering and leaving the room. Finally, we want to perform the correct procedure on the correct patient at the correct site every time. We will ask you to be involved in the process by identifying your surgical site and confirming the site that your surgeon has marked.
The day before surgery, you will receive a phone call from our surgery schedulers between 2 p.m. and 7 p.m. advising you of your arrival time to the hospital. If you are a Monday case, you will receive this call on Friday. During this phone call, you will be instructed a time on when to stop eating and drinking prior to your surgery. It is important to follow those instructions to allow us to safely proceed with your surgery. If you have certain medications that are safe to take the morning of the surgery, please use a small sip of water to help get those down.
On the morning of your surgery, you will come into the hospital and be brought to the preoperative area. Once admitted to the pre-surgery area, you will be introduced to your preoperative nurse. Your chart will be reviewed and any additional testing that needs to be done prior to surgery will take place. An intravenous line will be started. This IV will stay in place the entire hospital stay and will be used to administer fluids and medications. Any belongings you bring in with you will be securely locked up during your surgery. You will also meet your surgeon and one of our excellent anesthesiologists who will speak with you regarding your overall health and medical condition to determine which type of anesthesia is best for you. If your surgeon has not ordered it, you may also get a nerve block that numbs your shoulder and arm, including your hand and fingers, to assist with pain control after surgery. The block is a regional anesthetic technique. It is safe and effective way to provide excellent post-op pain control for you. The block works by numbing the nerves that run down the arm. These nerves are responsible for transmitting signals to the brain that indicates pain. By blocking this, it will help with pain control after surgery. You will still receive anesthesia on top of this block. It will last for 24 to 48 hours and work along with your other medications. As it wears off, you may start to experience increased pain. When your surgery is complete, you will go to the recovery room and your surgeon will either call or visit your family member to provide an update. After arrival to the recovery room, you will meet your recovery room nurse. They will be frequently monitoring your vital signs and pain to ensure that you are comfortable after your surgery. You are usually in recovery room for 1 to 2 hours. After the recovery room, you will transition to the orthopedic unit. If you are scheduled to leave the same day as surgery, you may go to the dedicated postoperative unit to be discharged from there. This plan should be discussed with your surgeon prior to surgery. Once on the orthopedic unit, they will also be monitoring your vital signs and pain regularly. This continues throughout the night. They are not trying to wake you up every 4 hours, but you have a lot of new medications on board and are still coming out of the anesthesia. Therefore, we need to keep a close eye on everything that's going on. Your healthcare team will try and cluster your care to provide you with as much rest as possible. Your diet will be advanced as tolerated. You will be started off on clear liquids and advanced to regular foods if there is no nausea or vomiting. Physical therapy will also see all patients the day of surgery. They will take you for a short walk with the use of a walker. Most patients do very well the same day as surgery and are able to walk a far distance. After surgery. After surgery, you may have a few different lines and drains connected to you. One of those new lines is a nasal cannula delivering oxygen. Getting you moving and using your bedside incentive spirometer 10 times an hour will aid in quickly removing this line. We ask that you take the incentive spirometer home with you and continue to use it over the next couple of weeks. You may also have a drain in place near your incision. This depends on your surgery and your surgeon's preference. If you are planning to go home the same day as surgery, the drain may stay in place until noted by the surgeon. After surgery, you may have a pair of pumps, also called SEDs, on your legs. These are simple sleeves that go on your calves and periodically pump up with air. These will stay in place until discharge while you are in bed. The purpose of these is to help prevent blood clots. To help us measure your pain after surgery, we will ask you to rate your pain before and after a dose of pain medication. Scale of 0 to 10, it is important to understand that all surgical pain cannot be taken away. Our goal is to make pain tolerable, which is generally around a 4 or less on a pain scale. Keep in mind that when you work with therapy or perform your range of motion exercises, the pain will likely increase for a short time. While medications may control some of your pain, there are other methods you will find helpful to assist in making you more relaxed and comfortable. Ice is extremely important. We will be giving you an ice wrap after surgery. You will be able to take this ice wrap home with you. While you are here in the hospital, we will put ice on your shoulder consistently. We ask that you consistently ice at home. The more swelling you can keep out of the area, the less pain you will have. At home, we ask that you ice at least 3 to 4 times a day for 30 to 40 minutes at a time. Your diet will be advanced as tolerated. You will be started off with clear liquids and advanced to regular foods if there is no nausea or vomiting. Occupational therapy may come in and visit you while you are in the hospital, depending on your surgeon's preference. If ordered, occupational therapy will educate you on range of motion exercises, sling use, and assist with dressing. As you recover from your shoulder replacement surgery, your surgeon will have provided you with specific limitations and efforts to protect your new joint replacement. New shoulder joint replacements are non-weight-bearing postoperatively and in a sling for a period of time designated by your specific surgeon. You should not be picking anything up heavier than a 6-ounce glass of water. In addition to non-weight-bearing, you will have limitations on your positioning of your new shoulder replacement, including no overhead, across, or body movements. These limitations will be discussed in further detail by your occupational therapist or orthopedic surgeon and should be continued until your surgeon advises you to progress. A sling is used to support your arm after surgery and should be worn at all times, unless otherwise specified by your surgeon. Your therapist will inform you of your surgeon's protocol. Wearing the sling correctly is very important. Be sure your elbow is all the way back into the pocket and that your arm is well supported. Additional sling information can be found on page 23 and 24 of your total shoulder book. Your therapist will ensure you are wearing the sling appropriately prior to discharge. Your sling should be worn post-operatively until your surgeon tells you it is okay to discontinue. Ice is a very important component to your recovery and comfort. It helps reduce swelling, inflammation, and pain. You will be provided with the ice pack and 4 refreezable ice packs. These are yours to take home, and we encourage their continued use. You can apply this ice pack to your shoulder immediately after surgery. This slide shows a list of strengthening exercises that can be performed after surgery. This is a list of some of the exercises that you should perform to help promote healing, increase range of motion, and reduce pain and swelling. This list is located in your total shoulder book that you receive preoperatively. It is important to review these exercises prior to arrival to the hospital and get familiar with some of the basic exercises you will be performing. You can do these exercises 2 to 3 times a day. If you are not scheduled to leave the same day as surgery, you will spend the night on the orthopedic unit and will likely be discharged the next day. The day after surgery, the expectations. If you are staying overnight in the hospital, the day after surgery, a staff member will be getting you up out of bed to the chair for breakfast. The nursing staff will help you order breakfast. You will also see the surgeon and the nurse practitioner, and possibly the hospital doctor if consulted. They will ensure that you are progressing well in your recovery and start to plan for discharge. If ordered by your physician, occupational therapist may come to see you. As mentioned previously, occupational therapists will work with you on a range of motion exercises, sling use, and activities of daily living, including bathing, dressing, and functional activity. This is all dependent on your surgeon's preference, and not all patients will receive occupational therapy. The day after surgery. If a home health consult is ordered by your surgeon, a home care coordinator will be visiting you and finalizing all of your home care arrangements while you are in the hospital. The home care coordinator will be advised of your surgeon's preference as well as which agency your insurance will cover. They will verify your insurance and the address that you will be staying at after surgery to ensure a safe discharge home. If you should receive a phone call from the home care agency by 12 p.m., the day after you are discharged, they will schedule an appointment at that time to come out to your home. The hospital will also make sure you have all appropriate medical equipment prior to discharge. This may include a cane, specialty walker, or shower chair, depending on your therapist or surgeon recommendation. You may have a copay depending on the type of insurance you have, but we will discuss that with you prior to ordering. Please hold on to your durable medical equipment for at least 5 years. Medicare will only pay for an assistive device for you once every 5 years, so do not give your equipment away or loan it out. The average length of stay after a total joint replacement is about 1 midnight or 1 postoperative day. Some patients will leave the same day as surgery if this has already been arranged with your surgeon. We do our best to provide a discharge time for you. On average, most of our patients leave the hospital between 11 a.m. and 12 p.m. We will have a better idea of that discharge time when we reach your day of discharge. But this time frame will allow you to prepare for obtaining a ride home. You may also have a drain placed near your incision. This depends on your surgery and your surgeon's preference. It is possible that you could be discharged home with this drain. Please follow your surgeon and nurse's instructions on care and management of this. After a shoulder replacement surgery, most patients will be discharged with a few new medications. Your surgeons will be prescribing these for you to take at home. Most patients will be discharged with the narcotic pain medication. The most common effects of the narcotics are constipation, nausea, and itching. You may also be discharged on either an oral anticoagulant such as aspirin or an injectable anticoagulant, if ordered by your provider. The medication is to help prevent you from developing a blood clot after surgery. The most common side effects associated with these are increasing bleeding and upset stomach. Additional prescriptions may include anti-inflammatories, stool softeners, and Tylenol. Discharge medication, bedside delivery service. If you need your prescriptions filled, we are able to do so before you leave the hospital and have them delivered directly to your bedside prior to your discharge. You will need to bring your prescription card to the hospital and will be responsible for any copays at the time of delivery. If you would like us to use this pharmacy, make sure you bring a credit card, debit card, or cash to pay your copay. There are no refills on this medication, so you do not have to come back. You do not have to use this pharmacy. It is just meant to be a convenience to you. Orthopedic discharge card. This card will be provided to you upon discharge. It is to be used if you find yourself needing to visit an emergency room. The card should be shown to the medical provider as our surgeons want to know if you are in the ER. Most issues do not warrant ER visits. Pain or incision concerns do not need to be seen by an ER physician and should be managed by your surgeon by calling their office. Chest pain and difficulty breathing are appropriate reasons to visit the ER. Online patient portal. Once you are discharged, if you have provided the hospital your email address, you will receive a link sent by the hospital. Please click on the link and you will be able to access your medical records.
Once you are discharged, if you have provided the hospital with your email address, you will receive a link sent by the hospital. Please click on the link and you will be able to access your medical records. After you are discharged from the hospital, you may receive a hospital survey that may be mailed or emailed to you after discharge, asking about the care you received while you were recovering at St. Joseph Hospital North. Please take a few moments to fill this out. In order for us to always provide our patients with high quality care, we need your feedback.
For questions, please call Crystal Taylor at 813-467-3341 or reach out to me by email at crystal.taylor@baycare.org. Thank you for taking the time to review this information. The Total Shoulder Replacement Team wants to ease your pain and help you regain your independence. Following the instructions in the book will help ensure you heal as quickly as possible. If you have any questions, do not hesitate. I would be happy to help. We will also contact you at the completion of this class to answer any questions that you might have.